Every black person in America knows somebody who has high blood. We eat so much salt at Big Mama's house on Sunday, and then generally that's why we have too much high blood pressure in the black community, in my opinion. But we'll talk about that later. The real name for high blood is hypertension. Blood pressure is a measurement of the force against the walls of your arteries as your heart pumps blood through your body. Blood pressure readings are usually given as two numbers. For example, 120/80. One or both of these numbers can be too high. The top number is called the systolic blood pressure, and the bottom number is called the diastolic blood pressure. Normal blood pressure is when your blood pressure is lower than 120 millimeters of mercury most of the time. High blood pressure is when your blood pressure is 140/90 millimeters of mercury or above most of the time. If your blood pressure numbers are 120/80 or higher, but below 140/90, it's called prehypertension. If you have prehypertension, which a lot of people do, you are more likely to develop high blood pressure. If you have heart or kidney problems, or if you've had a stroke, your doctor may want your blood pressure to even be lower than that of people who do not have any of these conditions. Many factors can affect blood pressure, like how much water and salt you have in the body, the condition of your kidneys, nervous system, or blood vessels. Also, the levels of different hormones in your body. When you get older, your blood pressure usually creeps on up, and this is because your blood vessels become stiffer as you age. High blood pressure increases your chance of having a stroke, heart attack, heart failure, kidney disease, and early death. African Americans have a higher risk of high blood pressure. You are also at higher risk if you are obese, or if you're always stressed out, or you're anxious. If you drink too much alcohol, that's more than 1 drink per day for women and more than 2 drinks per day for men. Imagine that. Also, if there's too much salt in your diet, almost everything we eat has too much salt in it. If you have a family history of high blood pressure or diabetes, it increases your chances of having hypertension. And if you smoke, you know I'm about to go off on you, because that's a huge risk factor for hypertension. It's killing you, brother man. Most of the time, no cause of high blood pressure is found. This is called essential hypertension. High blood pressure that's caused by another medical condition or medication is called secondary hypertension. And secondary hypertension is usually due to chronic kidney disease, disorders of the adrenal gland, pregnancy, medications such as birth control pills, diet pills, and some cold medicines, and in migraines. In our next segment on hypertension, I'm going to tell you the symptoms, the tests, and what will happen if you don't do what I'm telling you to do. I'm your favorite doctor, Dr. Corey Hebert, for BlackHealthTV.com.